Welcome to this video on restricted activities for the College of Respiratory Therapists of Alberta Registrant. This video will outline the key legislative requirements and definitions regarding high-risk health services in Alberta. This video covers definitions sourced from Alberta legislation. Key resources include the Health Professions Act, the Restricted Activity Regulation, the RT Profession Regulation, and the Pharmacy and Drug Act. Under the Health Professions Act and the Restricted Activity Regulation, restricted activities are defined as high-risk health services. They mandate specific clinical competencies and legal authorization to ensure patient safety. Let's review some key definitions. An activity of daily living involves routine tasks for health maintenance. Administration of a drug means providing a dose for immediate ingestion, application, inhalation, or injection. Continuing with our definitions, assisting requires on-site direction by a qualified professional. Competence refers to the combined knowledge, skills, and judgment necessary to provide professional services. A competent registrant is one who is adequately qualified and trained to work without supervision. Conduct is defined simply as an act or an omission. Regarding a drug, it includes substances referred to in the Pharmacy and Drug Act, or those with a physiological effect. A health service is any service to promote, maintain, or restore health. A registrant is a member registered under the Health Professions Act. A regulated profession is governed by the same act, and a restricted activity is a high-risk task requiring specific authorization. The list of restricted activities in Alberta is extensive. One primary category includes scudding body tissue or performing invasive procedures, such as those below the dermis, cornea, or teeth. Another category involves the insertion or removal of instruments, devices, or hands beyond specific anatomical boundaries, such as the ear canal, nasal passages, pharynx, or artificial body openings. Specifically, inserting substances into the ear canal under pressure or using materials that subsequently solidify is also a restricted activity. Restricted activities also include orthopedic interventions like setting fractures or reducing joints, chiropractic-style spinal thrusts, and prescribing or dispensing Schedule 1 and 2 drugs. Furthermore, managing vaccines, parenteral nutrition, blood products, diagnostic contrast agents, anesthetic gases, and radiopharmaceuticals are all restricted activities that require proper authorization. The application of ionizing radiation for medical purposes, as well as non-ionizing radiation such as ultrasound, including fetal ultrasound, falls under these restricted activities. Finally, the prescription or fitting of orthodontic, periodontal, dental, or implant-supported appliances is also classified as a restricted activity in Alberta. This slide outlines restricted activities related to providing health services, specifically psychosocial interventions. These interventions involve treating substantial disorders of thought, mood, perception, orientation, or memory that impair judgment, behavior, reality testing, or the ability to meet daily demands. Further restricted activities in Alberta include managing labor or delivering a baby, as well as the professional act of prescribing or dispensing corrective lenses. It is important to note that certain activities are excluded from this list. These include routine activities of daily living, providing general advice for personal or spiritual support, and the specific procedure of drawing venous blood. Regarding legal application, Section 2.1 of the Health Professions Restricted Activity Regulation confirms that regulated members are permitted to perform these activities as long as they fall within their professional scope of practice. Practice expectations are clear. A regulated member must only perform those restricted activities for which they are specifically authorized and clinically competent. These activities must always be appropriate for the profession. When considering your practice, ensure you align your daily responsibilities with the authorizations granted by your professional regulation and the overarching Health Professions Act. Regulatory frameworks are designed to protect the public. By adhering to the limits set out in the Health Professions Restricted Activity Regulation, you help ensure that high-risk services are performed safely. For registered respiratory therapists, there are specific basic authorizations. All RRTs are permitted to perform these activities, provided they maintain the necessary clinical competence. These basic authorizations are foundational to the practice of respiratory therapy in Alberta and form the core set of activities performed by most registrants. Some activities fall into a different tier, requiring advanced training and specific authorization. These are restricted activities that demand specialized skill sets beyond the basic scope. The next topic is the supervision of students and learners. When a student performs a restricted activity, Specific regulatory guidelines regarding supervision must be followed to maintain safety. A key question in professional practice is, who exactly is authorized to supervise a student or learner during a restricted activity? Supervision is a professional responsibility. Ensuring that the learner is appropriately guided is essential for clinical outcomes and patient protection. Students enrolled in approved health services programs can perform restricted activities. This is permitted with the student's consent and under the active supervision of a registrant, who is themselves authorized to perform that activity. In summary, maintaining compliance with these supervision standards is vital for both student development and the continued safety of the health service environment. Moving on to the supervision of non-regulated persons. Registrants have specific responsibilities when overseeing individuals who are not members of a regulated profession but are tasked with performing restricted activities. When supervising non-regulated persons, the registrant must ensure the activity is within the non-regulated person's role and that they possess the necessary training to perform the task safely and effectively. Regarding the application of non-ionizing radiation, such as ultrasound, registrants must refer to the College of Physicians and Surgeons of Alberta standards. These documents provide essential guidelines for maintaining compliance within your practice. Continued adherence to these ultrasound application standards is mandatory. Always ensure your clinical procedures align with the most recent protocols established by the CPSA to guarantee high-quality patient care. This concludes our video on restricted activities for registered respiratory therapists. If you have questions, please speak to your manager or refer to the relevant legislation. Thank you for watching.